All right, guys, welcome. So this recording is it's a talk that I gave to a group of integrative medicine, integrative oncology physicians. So it was a group of some family medicine doctor, mostly oncologists, and a few who were PAs and nurse practitioners. So the talk, it was this month, October 2023, and the group, I'll put the link in the video description. I forgot the name of the group, but actually the person reached out to me on LinkedIn and suggested, hey, could you give a talk to our oncologists who want to design some sort of a virtual practice? Maybe they want to do health coaching, maybe they want to build their own online practice. So I said, perfect, this is a great opportunity for me to kind of talk about this and give them a bunch of ideas of what they can do to go online. So initially, when we decided to set this up, I started creating just some basic slideshows, and then using Canva, where I created the slideshows, I just recorded on top of it. Canva has a nice option for you to just add your video recording, so it's just a little bit more personal. And this is something that is nice for me to create, put out there, hopefully help a bunch of you get some ideas as to what things you can do, especially given that you're oncologists. Most of you who are going to be watching this are oncologists, but I think a lot of the concepts are going to be quite relevant for family medicine physicians, for general practice doctors, for some nurse practitioners, I suppose. So let's see what you can do with it. So here we go. The name of it was Designing a Virtual Oncology Practice. The headline and maybe the uh, kind of the description, maybe like what I wanted to capture people's attention with is work remotely, live freely. And obviously, a lot of this is exaggeration. I always have to catch myself when I say things like this because whenever you build a practice, whenever you build your own business, you're going to be tied down to it in many ways. One thing I've noticed over the past few months is that ever since I started creating my online course and I started putting more time and effort into my heart health coaching and into my virtual telemedicine practice, there's a lot less free time that I have. Now, I justify it by saying that, okay, well, if I put a lot of time and effort into it now, maybe in the future I'll have some extra free time. That's not always the case, so you have to be careful. But I do believe that the ability for me to work online and have my own practice, do the coaching that I do the consulting that I do, all of that has given me an incredible amount of freedom. So, my name is Dr. Mo, Mohammed Ashori, MD, family medicine doctor. I have my own virtual health practice, a telehealth practice in chronic disease prevention, pure telemedicine. I have a heart health coaching brand. All of these are things that I'm still kind of developing, building, growing. The heart health coaching is something I was passionate about, cardiovascular medicine. And I really just wanted to stay in the coaching role. I really didn't want to prescribe medicines or anything. I have no desire to do anything like that. And the final thing that I do is the consulting. And we're going to get into all of that. You can find me at digitalnomadphysician.com, and you can also find me on LinkedIn. And the reason I created this was also to kind of publicize my course, my online Build Your Own Virtual Medical Practice course, which is starting November. So in just a few days, we're October 21 now when I'm recording this. So, as far as my disclosures, I always talk about this. Obviously, I have a financial gain here, right? I'm talking to you about this because I get to benefit and profit from you either buying my consulting sessions, like coaching sessions for physicians, or if you buy my online course, I'm going to make $1,500 from that course. If somebody finds me and is interested in my heart health coaching, I'm going to make money from that, etc. So obviously, I'm biased, and these are my disclosures. But I do believe that mainstream medicine can do a lot better when it comes to the delivery of health information. I think we can be more unbiased and we can help more people. And that's why I want to create my own practice. So, how much can you earn? That's always the first question that many oncologists might ask when the idea comes up to have their own freedom to practice from anywhere, not have to be tied to a hospital, not have to be tied to a radiation or chemo suite, right? They want to do what they want to do from anywhere in the world. So I think that's the wrong question. Don't aim to replace your income if freedom is what you value. If you're just after money, I am not the right person to listen to. In fact, I'm probably somebody you should immediately turn off and stop listening to, because I'm all about optimizing for the things that I value most in my life, which does not happen to be money right now. It is enough money for me to live a comfortable life, but that definition has changed from back in the day when I was making $30,000 a year, 30,000 a month, $30,000 a month, and now when I make probably about eight, give or take. And that's a huge difference. And the eight is even way too much. And the reason I'm earning the eight is because I'm trying to maintain my lifestyle. And at some point, I went all the way down to just needing $1,500 a month to live off of. So keep that in mind, because we don't want to replace income. We want to optimize for the ideal quality of life. So, virtual oncology, if you were to build something like this, as a virtual oncologist doing pure telemedicine, you could expect to earn somewhere between 250 an hour to 2,000 an hour. The reason these higher numbers come up is because that initial consultation could be for quite a lot of money. And you might also be selling courses to people where they're learning certain things asynchronously from you. So while you're doing one on one coaching, you're selling a course for a certain amount. And these people are learning and gaining information, feeling empowered, etc. Or you might have other people working for you. But it's not uncommon to see some physicians charge $1,800, $2,000 for initial consult, and then $800 per hour afterwards. It's just that we, as insurance-based physicians, aren't accustomed to these numbers because we think people will not pay it. But if you think about oncology and how much people value their life, the average life quality years is measured at about $100,000 in the US right now. And I think the recent estimates is $120,000 a year, meaning that if I cut somebody's life short by 1 year, I would be responsible for $120,000 for them. And if you can imagine, most people don't earn anywhere near that. So the quality, the value that we place on our lives is quite a lot. So $2,000 may not be all that much when you consider $120,000. So, what about coaching patients? Well, we don't coach patients, we coach clients, right? Because if you coach a patient, you're engaging in the practice of medicine. So, in this previous one, this is virtual oncology. This is you going online and creating a telehealth practice, right? That's the course that I'm selling right now. Purely virtual telemedicine. How can I build my own practice? Everything from legal to business to marketing to everything. This is coaching. This is different. This is having a bunch of people come in on group calls or one-on-one calls, and I'm coaching them. I'm talking them through their health crisis. I'm talking them through how to live a better quality life. I'm talking to them about how to change and optimize their diet, right? It's a very different concept and idea. Okay, I should also mention, as far as the prices are concerned, right? How much can you charge? And in general, it kind of falls around the same. So here we saw 250 to 2,000 an hour. In health coaching, it's probably going to be a little bit less, but remember, you're taking on a lot less stress, you're taking on a lot less responsibility. And it's common for many health coaches online to have fellow coaches that they hire for a lot less. They pay them obviously good money, but they pay them a lot less than the money they're earning from their clients. So somewhere around 150 an hour to 1,500. Now imagine if you're earning 150 an hour, that's probably not a lot, but it's also not bad. That's $300,000 a year if you're working full time. And if it is something that you love doing, it's an incredible income when you think about it. It depends on what you like, right? To each their own. Clinical consultant and advisor. So this is the third arm, and we're going to get into the triangle of consulting, coaching, and being a clinician. We're going to get into that in just a moment. But you can imagine that if you're a consultant for a large company, you might charge a minimum of $150 an hour for your consultation. As an oncologist, you probably will start at about $150. Chances are, once you get going, if you consult for a healthcare startup, a medical device company, a pharmaceutical company, you're probably going to charge at least $250, $300. However, a lot of times as you get better, you improve, you're probably going to charge a set amount, meaning you're going to charge for a project. You might charge somebody $10,000 for a project, and when creating that project, you may end up only spending 4 hours. All of a sudden, you realize, oh my gosh, this took a lot less time than I thought. So all of a sudden, for $10,000, you only spend 4 hours for that $10,000 project. You make $2,500 an hour, right? And that's quite common, especially once you get up higher and you start charging these retainer fees from your clients. As far as the skills, what skills do you have? You're an oncologist, right? You probably think the main skills that you have is in the arena of oncology. Maybe you'll say, "Oh, I also have some internal medicine skills." Hold on. Well, the reality is that you have many skills. You have customer service skills because you know how to deal with clients and customers. You know how to follow directions from higher ups. You know medicine, clinical medicine in all aspects. You understand medications, side effects, where they come from, how they're prescribed, probably even how they're created and what the complications are. Maybe you know a lot about compounding pharmacies, etc. You understand regulating agencies. That could be the state medical board stuff. It could be Medicare, Medicaid, and pretty much every other regulating agency that we deal with, JCO, etc. You understand health and well-being. You know that some of your patients might be in perfect health, but they don't feel well, and you have patients who are not by in any stretch of the imagination in good health, but they feel well. Their well-being is optimized, and so you understand that, and I think that's a powerful skill to possess, especially when it comes to health coaching, for example. You know how to research a topic. You know how to go and figure out this type of breast cancer with this, and where can I send my patient for this, and is there something they can get enrolled in, some research study. You're very good at researching topics. You also know about teamwork. How do you work with different groups? How do you work with nurses, medical assistants, fellow physicians, medical students, residents, etc.? In that regard, you're also a great teacher, right? You know how to follow orders, which means that you can, state medical board says this is what you have to get done, this is what you have to do. Your board certification says you have to do this. Boom, you will get it done. You're responsible. You're reliable. You can prioritize tasks. So task prioritization is incredibly important whenever you get into kind of the consulting role, because you need to know that, hey, this is what we need to do now. I got to set this aside. Boom, I got to switch tasks and go to this because this is more important. And that's something a lot of people don't really know how to do. If you have a line worker in a factory or in a jack in a box, right? That person is probably not going to know how to prioritize certain tasks that are more important. That's why they are assigned one particular role, and that is it. Computer technology, many of us are accustomed to that. Communication, how to communicate with higher ups and people below you, how to communicate effectively, efficiently, safely, etc. And something I already mentioned is education and teaching, which is incredibly important, but also a wonderful asset if you ever want to build out a teaching platform. And just so I remind you guys, those of you who are oncologists, physician, nurse practitioners, PAs, you're already a business. Why do I say you're a business? Because you are a brand. The way I talk, the way I carry myself, that's my brand. The way you carry yourself, the way people see you, it's a brand. You constantly are putting certain amount of effort into presenting yourself the same way every single time. You're also a product because you're traded, you're sold, you're bartered for. You're transferred from one medical group to another. You are let go. You're a product in that sense, and in an asset, obviously, for many medical groups. And you're also constantly selling yourself, which is what a business does. You're selling yourself to the patient. You're trying to convince them that, hey, listen to me, trust me, I have your best interest in mind. I want you to do well. I know the medications have side effects, but have faith in me that you will get better, and this will overall result in a better outcome. And you're constantly advertising. You're constantly trying to let your potential employers know that you're doing a good job on your LinkedIn profile, on your resume, etc. You're constantly trying to demonstrate that you're still a good investment, right? That's what a business does. I talked about this triangle. I think this is valuable because we mostly see ourselves in the top of that triangle. We mostly see ourselves in this clinician part of the triangle, but I actually think we have a lot more skills. We're competent, we're curious, we're committed, we're candid, we're credible, we're clear, we're conscious, we're collaborative, and we're compassionate, right? And this encapsulates not just clinicians, many other people have these kind of skills and abilities. In fact, there are health coaches out there who never went to medical school. They were financial advisors before, and now because of their own health journey, they have all these characteristics and are helping people, really genuinely helping people. But as a physician, as a clinician, as a nurse practitioner, as a PA, you already have a really solid understanding of clinical medicine. That makes you the perfect ideal person to be a coach, right? To teach someone, to walk them through their habit changes, to encourage them, to support them, to share resources with them. And you can also be a consultant because now you have this expertise as a clinician, as a doctor, as a teacher, as an educator, as a healer. You can take this information and help these medical groups, these large business entities, these medical device companies make better products, reach patients in a better way, make a difference, right? Sure, there are a lot of chemotherapeutic agents being discovered or in the pipelines, etc. But what is it that patients need, right? That's what a consultant is there for. What is it that the patient needs? What is the actual pain point of a patient? Are we really solving it? Are we, by giving them an extra 2 weeks of life based on this study, are we really changing their outcome? What is it that the patient is after? And that's the piece. That's the piece of consulting. What I love about consulting is I get to give my input as a physician to a business entity and actually drive a better outcome. And I feel like, make patients' lives better. So, in general, what I recommend to patients, not patients, to physicians, is to try to create this triangle model. Try to create three different entities for yourself, where you are a clinician, where you are a coach, and where you are a consultant. I say this because it helps you feel more engaged. It helps you fight some of the feelings of burnout, but it also gives you the ability to have different income streams so you feel more not secure, because that's always kind of a false impression, but you feel more resilient. You have some sort of some ability to have different types of income, right? There's redundancy. You feel stable in some ways. So I highly encourage people to pursue that. When it comes to me, my brand is, I have a virtual medical practice. So I'm a physician, I'm an online physician, but I also work in the urgent care, right? So I can still go back to, for example, Los Angeles and pick up some shifts, and I'm just a regular old urgent care doctor. But I'm also a physician coach because some of you find me and you want to ask me questions. How do I do this? How do I do that? How do I switch jobs? How do I build my own practice? Right? So I'm a physician coach, but I'm also a heart health coach because I decided to specialize in that field. Now, I could have picked something else, but for the time being, heart health coaching seems something that I'm interested in. And I'm a business consultant because I sell my expertise and information to different business entities. Currently working for a medical device company, before that, a software company, and before that, many other different types of healthcare startups. So, consultant, coach, physician, right? You could be any of these that you want. So, we're going to go through all three of these for an oncologist. We're going to go through the top part, which was the clinician, right? We're going to go to the bottom part, which was the coach, and we're going to go to the other side, which is the consultant. The first one is going to be, you're going to build a virtual practice online, and what is that going to look like, and what can you offer? So the first one is, obviously, you're an expert in cancer X, and somebody comes to you and says, "Hey, look, I have DCIS. They already removed the mass. And a couple of my surgeons or oncologists are recommending that I do chemo. Some are saying that I should do radiation. Some are saying I should do lymph node biopsies. What do you think? I would like, you're the oncology expert in breast cancer in DCIS. And that's how niche you can be, in fact, in this field. What do you recommend I can be?" Now, of course, you could just be breast cancer oncologist expert online, or you can just do DCIS if that's what you're interested in, or estrogen receptor positive cancers, or whatever your expertise is that you're interested in, from colorectal cancer to head and neck cancers, etc. So if you're this expert, somebody is going to come to you and they're going to ask you for your guidance and, like, "Hey, can you help me manage it?" And you might get on the phone call with with their physician and kind of guide the care. You can have patients in just California. You can have patients all over the U.S. and all over the world. In fact, there is nothing preventing you from engaging in a patient-doctor relationship with another human being from another country. There's nothing wrong with that. Currently, there are no laws against that. Of course, as things change, we always evolve. And that's why it's important to stay on top of things. That's the obvious one. The second one is giving just second medical opinions. This is a bit more complicated. It's a bit different. In this role, somebody comes to you, dumps all of their imaging studies, dumps all of their studies, dumps all the pathology on you, gives you all the previous reports, and says, I would like a second medical opinion on how to proceed. A second medical opinion is more involved. You're going to review a lot of things. You might even pay some other surgeon or specialist or pathologist to help you come up with your recommendation. Often in the second medical opinion, it's just an individual physician, just one person doing this. Many times, quite a few second medical opinion option practices that exist, again, very few of these, it's a group of physicians that come together, and like there's a radiologist and there's an oncologist and there's a surgeon, etc. They all come together to review the case and they give you an opinion. I think the cheapest that I know right now is $1,500. Quite a few are at about $2,500. And to be honest, it doesn't make sense to me for anything less than $5,000. So I really would be charging quite a lot for something like this. So you could also be the oncologist who is a chemo and radiation expert. Which chemo regimen, which radiation protocol, what do I need to do for what cancer? That's it. That could be your niche, as simple as that. It does fall a little bit in the second medical opinion space, but it could also be the complications from chemo, the complications from radiation, how to prevent chemo complications, how to prevent radiation complications, right? When to continue chemo, when to stop chemo, etc. You could be an expert in complementary care, right? So kind of holistic stuff, alternative stuff, herbal supplements, etc. You could just do imaging interpretation for patients. So in a way, you have them upload their MRI, PET scan, CT scan, ultrasounds, etc., and you're just giving them an interpretation based on your specialty. If it's neuro, if you're more interested in neuroradiology type stuff, if you're interested more in like bone cancer type stuff, whatever it is, that could be your expertise. Recurrence. So quite a lot of patients are both trying to prevent recurrence, so that's the next one, prevention, or they're trying to manage their recurrence. So those are the things that you can specialize in. And that's the beauty of having an online practice. You no longer are relegated to an in-person practice where you're getting money from an insurance company. Obviously, all of these are cash-based, right? You can go directly to the consumer. You can go directly to the patient, and you can specialize in whatever you want. And for example, for me, for my digital nomad health practice, I'm focusing mostly on patients who are digital nomads based out of California. So they're nomading all over the world, but they originated from California, and they're interested in chronic disease prevention. They want to prevent any kind of chronic disease. That's as niche as you can get. Jesus Christ. I mean, it couldn't get more niche than what I'm doing, right? And that's why it can be difficult to find patients, but that's my goal. All right, so this one is virtual medical practice logistics. So the first one was virtual medical practice, and now what do you need to start and build a virtual medical practice? Honestly, not a lot. You need a communication platform. This is often something like Spruce, as you can see down here. It's like a WhatsApp for patients. You can leave audio, video, share documents, etc. And it's HIPAA compliant. By the way, WhatsApp is way more secure than Spruce. However, because of HIPAA compliance, there's no reason WhatsApp would ever want to get into that business of signing a BAA with you and having to deal with regulators and having the FBI come knock on the door, state medical boards come knock on the door and request documentation. No, they don't want to open that up to anyone. But sadly, as it is right now, these are the options that we have. And Spruce is okay. It's not that bad, but there's way better options. It's not expensive, about $20 a month. You need an electronic health record. Fortunately, you're not dealing with insurance companies. You're doing cash. You're not doing Medicare. You're not doing Medicaid. You're not doing Aetna, Blue Cross, Blue Shield, etc. You're documenting for yourself. You're only documenting for yourself, right? That's the beauty of it. And so the whole SOAP thing goes out the door. You can document any style you want. There's no more getting vitals on patients. There's no more, all these sentences that we put in there is garbage and is just there for the insurance companies. You can just write the things that you think is valuable and important for the patient to have. So electronic health record, acute health is super cheap, $50 a month. You can use Athena, you can use Hint Health, you can use Atlas MD. There's a lot of different options. They're about $300 a month, and they're a lot more fancy, and they have a lot of other options. They have patient portals, etc. Legally, I highly recommend the functional lawyer. You can just check out his website, functionallawyer.com. And there is a lot of legal documents that you kind of need for the patient to sign. You do need malpractice insurance, which you can purchase through many different types of malpractice insurance carriers. And marketing. When it comes to marketing, you can just do Google ads. You can do Instagram ads. There's some limitations as the kind of ads that you can run, but healthcare companies can run ads, fortunately. It's not yet limited. The next thing we're going to talk about is virtual health coaching. So we did the clinical part. Now we're going to do the coaching over here. So the coaching, you can be a patient advocate, just a patient advocate. I will be there with you the whole way through as you go through your process, from diagnosis of your cancer to the treatment of your cancer to everything else. So just being a patient advocate, you're helping them navigate the health insurance system or their insurance system or whatever it is that they're trying to navigate. Or maybe if they're in another country, you're trying to help them navigate their cancer based on the information you have as an oncologist in the United States. Now, as a health coach, you have clients, you don't have patients. So you have to be careful with the terminology and things that you use. And the good thing is we're not trying to be their doctors, right? We're just trying to be their coach. End of life planning can be incredible for oncologists. And I think you guys have a lot of expertise in that, especially when it comes to family members and bringing everybody else into the mix. Living with cancer. How do you live well with cancer? How do you thrive with cancer? How do you do your exercise if you have bone cancer and you had surgery and you had radiation? How do you manage eating something, taste buds, all of that stuff? Cancer fears. I think there is a big need for mental health space in oncology, and there's no discussions of cancer fears, like the fear of cancer, the fear of living with cancer, the fear of eventually getting cancer, testing, screening, preventing. Not a lot there, especially not in the health coaching space. Cancer diets. The kind of diet you should have when you have cancer, the kind of diet you might have or ideally have to prevent cancer. All of that is incredibly important, and diets to have to help prevent recurrence. I'm not an oncologist, so I have no information about that. Certainly have heard some things, but you use your own best judgment. Spontaneous remission. I know there are many physicians who are interested in this space, and I've written about it. Dr. Weil has written about it. I don't think it's bogus. If you think it's bogus, obviously ignore it, do your own thing. But there are patients who believe in spontaneous remission, and they might reach out to people who are not quite as genuine. But if you're a physician and you're in the spontaneous remission space, I suspect that you're going to do a better job. Living pain-free with cancers, the fear of having pain with cancer. And of course, the international aspect, which I already talked about, like, can you be somebody's advocate, or can you help them manage their cancer, be their coach as they deal with it, and even if they're in another country, right? That's kind of like expanding your market reach. So what do you need to run a virtual health coaching practice as an oncologist? You need some sort of communication tool, just like before, and usually I recommend WhatsApp. It's super simple. That's what I do with my heart health coaching clients. I just do WhatsApp. We just send voice messages back and forth and text messages. And quite honestly, we just do the one-on-one live. And that's pretty simple. What do you do for billing? How do you bill? PayPal. PayPal is the easiest. So I have something called Calendly. So I link everybody through my calendar. They go on my website, cardiachealthcoach.com. They book my Calendly link. They pay me, I think it's $175 right now, an hour, and they pay with PayPal. Once the PayPal comes through, they get to book the times that's linked to my calendar. Everything's done automatically. I'm not involved at all. Once they pay, boom, that's when we start our conversation. Well, depending on when they book the appointment, I call them. Easy. I don't do video. I only do audio. I charge double for video. If somebody wanted to, I'd charge them like $400. And marketing. How do you do marketing? Well, obviously Google Ads is very good way to do any kind of marketing that you like. Instagram is very easy. Organic marketing is usually through just creating a ton of content. Blog posts, podcasts, audio, and video. Remember, there's only 3 types of content right now. Hopefully we're going to have a lot more in the future with technology advancing, but right now it's written, verbal, and video, right? So as long as you're creating any of those three content, it doesn't matter where you're going to post it, whether on TikTok or YouTube or Instagram or Twitter or any of these platforms. All right, so the next one is going to be medical consultant. So we got clinical, we got coaching, and now we're going to do the medical consultant. The consultant is the person who generally has clients who are businesses or business entities. Now, you can even have clients that are countries. You can consult for a country that is trying to build out their oncology practice. Now, you think that's not possible? Oh, they're just going to get somebody else to. No, why? You don't know that. You can be an expert. to help somebody build something. You could do it for a hospital group. You could do it for a clinic that's trying to add oncology to their practice, right? And of course, you can just be a medical consultant for billing if that's what you're into. If you understand billing very well, you could do that. You could take some billing courses. Oncology ontology. So if you want to help medical device companies or healthcare startups, which are in the large language model space, we can help them with all the different types of terminology that exists in oncology, but also terminology that patients use to describe their signs and symptoms. That's the ontology part, and you can be a consultant there. Patient communication, how to best communicate with the patient, how to properly communicate with the patient, how to make a patient feel heard, how to deal with physicians who have a hard time communicating with patients, how to teach health coaches or health proxies to communicate properly with patients. Creating clinical guidelines, that's very important. Virtual oncology, so how do you, like, if let's say you build your own virtual oncology practice, hopefully you'd be doing some consulting and building out a proper virtual oncology space, right? Research interpretation, you guys are already good at that. You read a lot of research. And there's quite a lot of oncologists who are quite loud in the research interpretation space, but learning how to interpret research, coming up with algorithms, et cetera, is a really powerful way for companies to make sense of the data that's already there. A fractional CMO. So imagine a company is starting something in the oncology space and they need a chief medical officer who can be there for just a few months until they hire a full-time CMO. You can be a fractional CMO. You can step in and help them out while they get things going. You have to understand what a CMO does. I've written a lot about that at digitalnomadphysician.com, and you can read that to your heart's content. Empathy, compassion training. So if you find yourself to be somebody who's very good at that, patient communication and empathy and compassion, it's a great thing. It's a great thing to consult for. And finally, ethics. So whether it is dealing with resources, whether it is dealing with patients and family members, et cetera, ethics is a great topic to be a consultant in. And there's quite a lot of companies that are investing heavily in this ethics space, even insurance companies. So what do you need to be a medical consultant? This one is obviously incredibly easy. Same thing, Calendly is the one I use, and PayPal. That's it. I bill through PayPal and I book all my calls through Calendly. Now, one advice that I will give you when you first start, don't be afraid to start your prices a little bit lower, but at the same time, be sure to raise your prices quickly. Don't sell yourself short. And don't let people reach out to you for free. Nobody can reach out to me for free because I value my time. I like the things that I do. So if somebody wants to reach out to me, the only way to reach out to me, I don't give my email out, even though it's everywhere. It's easy to find if somebody wanted to find it. And in general, I ignore it unless they pay me. This is not because I'm greedy. This is because there are so many things that are pulling me in so many different directions. I need to put some sort of a break or barrier on my time. Otherwise, I would have no free time to spend with myself or my loved ones. So if somebody wants and values my information, my knowledge, they're going to pay me for it. And they can do it very easily. I make it much easier for them to find my pay link than my email link. Basically, that's the way I do it. All right. So what is your ideal client avatar? When it comes to the ideal patient, the ideal customer, the ideal client, what do they look like? You need to answer that for yourself, whether it is consulting, coaching, or clinical medicine. What is your ideal patient? Is it the grandma with end-stage breast cancer? Is it the young person who has a lot of health anxiety and wants to prevent cancer? What is your ideal business that you'd want to work for? Would you rather work for pharmaceutical companies, attorneys? Would you rather work for healthcare startups? Are you really into technology, right? Coaching client, who would you like to coach? Would you like to coach somebody who's already empowered and educated and knows a lot? Or would you like to start with people who absolutely know nothing and you really want to make a difference in their lives? Do you want to be working with international patients, Spanish-speaking patients, or you want to work with mostly United States patients, so USA patients? That's the other thing to figure out. To get paid, there are many ways to get paid. And remember that these are just a limited number of options, because in the end, what you're going to figure out, it's like writing a book, right? You may not know all the different characters that you're going to develop until you write the book. And it's the same thing. Until you do the business, you're not going to know all the different ways that you can get paid. You can do membership. You can sell online courses. You can charge somebody hourly. You can sell them a coaching package. You can do group classes where everybody pays a little bit to come in the group class, and all of a sudden you make a lot of money from a large number of people. You can host retreats in different places. You can give lectures where you get paid to lecture. And you can give away stuff for free, hoping that that's going to drive the sale of something else on top here. When it comes to building a business, this is the second to last slide. I always recommend adding numbers to slides just so people know, like, thank God I'm done. What do you need to do to build a business? Well, what should you do and what shouldn't you do, right? Don't reinvent it. Many other people have already done what you're thinking of doing, and there's plenty of room for competition. There are 750,000 active licensed physicians, half of which are probably primary care doctors. No, more than half are probably primary care doctors. 500,000 are probably primary care doctors. 250,000 in the US are probably some sort of specialists. We got at least 400 legal citizens in the United States, 400 million. So that's 800 patients per person, per physician. There's plenty to go around. And that doesn't include the 7 billion people on the planet. So don't reinvent it. It's already been done, and there's plenty of people to market to. Find somebody that you like and the way they're doing things, imitate it, copy it, and then stratify it and improve it based on what you need. Don't pay for solutions. It's very easy to immediately go and pay a company $75,000, $150,000 to set up your telemedicine practice, to get all your documents in line. And all of a sudden you turn around and you're like, I don't know how to run any of this, right? So don't pay to solve a problem, and instead think through it slowly, start spending slowly, and increase your spending, especially when it comes to marketing. I've made the mistake. I've spent a lot of money on marketing, and then I realized, okay, let me start small, see if it works, and then go from there. Don't skip legal. It's very easy to want to skip the legal part of it. Do pay for some legal protection. It's worthwhile, and I think a lot of us benefit from having experts in the healthcare space. Healthcare is a very highly regulated field. There's a lot of things that you're not going to know, especially when it comes to state licensure in different states, if that's what you're after. And don't complicate it either. Don't try to build something super complicated from the start. Do an MVP, a minimum viable product. Build something small and expand it from there. When it works, when it makes some money, take that money, put it back in the business. Now, I'm not saying that's not the perfect situation for all of you. Some of you have grandiose goals. You want to create the biggest, largest virtual oncology practice in the world. For you, yes, put all the money in that basket. Do write a small business plan, tiny bit, 3 paragraphs. That's all you need. Have an idea of what it is you're building. Do trial and error, experiment. If it fails, reiterate, redo it. We call it A/B testing. Hire people. Try to hire some people to do some of the work, because you will have to at some point hire people, virtual assistants, virtual medical assistants, etc., and make it fun. Make sure this is something you enjoy. Don't create another job for yourself. If that's the case, just go work for Kaiser Permanente, right? Make it easy. But if you believe that you can make a difference in somebody's life, and you can make it better, and you can enjoy the process while doing it, if you can grow from it, then this is a worthwhile endeavor, in my opinion. And finally, I do want to say, do check me out at nomadphysician.com. That's where I host my online course. Digital Nomad Physician is where I talk about everything that I talk about: telemedicine, coaching, consulting. This is where I really just preach to the physicians. Digital Nomad Health is my telemedicine practice. Cardiac Health Coach is my health coaching practice. So that is it, guys. If you have questions, leave your comments below. I'm excited to hear what you guys are thinking about, especially you oncologists, what ideas you have, and we'll go from there. Take care.